Regenerative medicine is one of the fastest growing fields, with new papers published every single day. As a busy mom of two, I'm guilty of not making the time to keep up with the research, and I think a lot of other veterinary professionals are in the same situation. My name is Dr. Adrienne Wright, and welcome to Sit, Stay, Learn, a short podcast where I review regenerative medicine uses in veterinary science. Each episode, I break down a paper, and then we just spend 10 or 15 minutes just giving you the details you need to know to feel like you're staying up to date with the research. With it being just past the spring meet at Keeneland, I wanted to show a little love to horses, and I really enjoyed this paper. They did a great job comparing Orthobiologics to Triamcinolone. This paper, titled Effects of Autologous Conditioned Serum, Autologous Protein Solution, and Triamcinolone on Inflammatory and Catabolic Gene Expression in Equine, Cartilage, and Synovial Explants treated with IL-1 beta in co-culture, was published in Frontiers in Veterinary Science in 2020. And the study objective was to investigate the effects of autologous conditioned serum, we'll use ACS going forward, autologous protein solution, APS, and triamcinolone, TA, on inflammatory and catabolic gene expression of inflamed joint tissues in co-culture. I think this group did an excellent job of not only comparing two of the most common orthobiologics out there, but to compare how these do to TA, which is the question on everyone's mind. We all know what orthobiologics are up against, and corticosteroids are what veterinarians are going to reach for first. So lameness due to osteoarthritis is a leading cause of stopping or reducing performances in horses. And it has been shown to affect around 80% of the equine geriatric population. The most common treatment is to modify disease symptoms through a temporary inflammation reduction with corticosteroids, which can last for several weeks, up to about 3 to 6 months. And for high motion joints, TA is the most common steroid that's used. It's been shown to be chondroprotective in a few in vitro studies, but as with any steroid, there's still the concern of repeated long-term use. And as we know, osteoarthritis demands repeated and long-term use to make the animal comfortable. And even that is not enough sometimes. So this is where orthobiologics come into the scene. Blood-derived orthobiologics like ACS and APS are therapeutic options for clinicians looking to treat joint-related injuries and osteoarthritis. Although both products are blood-derived, their cellular and protein profiles are slightly different. There are several studies that have characterized both products if you're interested, but there are limited studies on looking at the profiles between the same donor and then to see how those products might compare clinically. I use the term might here because this is obviously an in vitro model. But there are several publications that have demonstrated clinical improvement in lameness with horses treated with ACS or APS. But we don't have a lot of data on how they perform head-to-head and then how they would perform against TA. So this paper utilizes synovial and cartilage explants cultured together to have physiologic responses that should closely resemble OA tissues in situ. But I want to stress that it resembles. So, although we can gain some insight, it is not necessarily a perfect representation of what would happen in vivo. The study had 6 quarter horses, 1 mare, 5 geldings. The average age was 14.9 years. They were free of systemic disease, but being euthanized for reasons unrelated to this study. They also excluded any horses with a history of lameness related to the stifle, and the horses had to be classified as healthy by a physical exam and a CBC. For the co-cultures, they really looked into the rodent and human literature. They used cartilage explants over top of synovial membrane explants, and then they allowed the cultures to acclimate for only 2 hours. But they used a short period of time so that they didn't have to cryopreserve the orthobiologic. And I think that this is probably both a strength and a weakness to this paper, because on one hand, using the orthobiologic fresh and from the donor is most clinically relevant, but then on the other hand, a 2-hour acclimation period may not be sufficient. But with the study design and wanting to mimic what's happening in clinic, I think their options were really limited. So unless they wanted an allo orthobiologic, and again, that's also not clinically relevant to what you're doing. So I digress there. They tested unstimulated controls, a stimulated control, both APS and ACS at 25 and 50% volume to volume, and then TA at 1 micromolar. All samples except the stimulated control were then all samples except the unstimulated control were stimulated with IL-1 beta. Analysis included cell, cytokine, and growth factor testing, and then when you look at the cell profile of ACS and APS compared to whole blood, they are different. ACS has lower red blood cell, white blood cell, and platelets. APS had higher white blood cells and platelets, but lower red blood cell. And then when you compare those to one another, APS had significantly higher white blood cell, red blood cell, and platelets than ACS. So, although the cellular profile for the two orthobiologics was quite different, the cytokine and growth factor content in the products were quite similar. I find that really interesting. As with any biologic, there's a lot of variability between horses, with TNF alpha being significantly different among the donors. But between products, no significant differences were noted for IL-1 beta, TNF alpha, MMP3, and IL-1RA. But ACS was significantly higher in TGF beta and soluble TNF receptor 1. Looking at the ratio of IL-1RA to IL-1 beta, so it's going to tell us how much anti-inflammatory you have compared to the pro-inflammatory. ACS did have a higher ratio, but this was not significant. So, for the culture to mimic an OA environment, they measured PGE2, a primary pro-inflammatory mediator, and it's highly secreted in an OA environment. So after stimulation with IL-1 beta, PGE2 concentration increased 4.7-fold. After treatment with TA, PGE2 was reduced, but not significantly. The p-value was 0.11, so not even borderline. PGE2 was significantly reduced by both ACS and APS, with APS at 50% being the most effective. Gene expression data confirmed that stimulation with IL-1 beta produced an inflammatory response. It upregulated IL-1 beta, TNF alpha, IL-8, and MMP3. That one was in synovial, and then IL-1 beta and TNF alpha was upregulated in the cartilage. Interestingly, only TA significantly downregulated IL-1 beta expression in both membrane and cartilage, and it trended to downregulate IL-6. However, it did not downregulate any other inflammatory genes. ACS and APS downregulated IL-1 beta and TNF alpha in cartilage and showed a trend to upregulate genes COL2A1 and ACAN more effectively than TA. APS trended to downregulate MMP1. Both ACS and APS trended to upregulate ADAMTS4 in cartilage, but downregulate it in the membrane despite the differences in platelets. And the authors bring up a good point here that other studies have suggested high platelet concentrations might produce a pro-inflammatory environment in cartilage. However, this was cited as a single study, and I think this data would put that into question. I think these results inherently don't make a ton of sense, so this definitely should be investigated further. They do have small sample sizes here, so it is pretty well understood that IL-1 beta stimulates PGE2 production in vitro. So decreasing IL-1 beta expression could lead to less PGE2 production. IL-10, also a potent anti-inflammatory marker, also leads to downregulation of PGE2. So, low PGE2 with upregulation of IL-10 was observed in both ACS and APS. So, the team makes a valid hypothesis that upregulation of IL-10 will lead to less PGE2 production in vivo, which we saw in the culture. And since PGE2 has been shown in humans to sensitize nociceptor neurons, then they make the jump that perhaps downregulation of PGE2 by APS and ACS could explain the clinical improvement in lameness seen in multiple studies. I think this is an interesting and a valid hypothesis, and something that's really tough to flesh out when you're dealing with biologics. What is the mechanism of action? And when you're looking at something like a traditional drug, they want you to flesh out the single thing that's causing the benefit. And it's usually not a single thing. It's usually multiple things. And then when you have a biologic, you're obviously having an interaction of all of it. And so it just gets really tough to prove. But I like this conclusion they made. I would love to see this tested further, definitely in vivo. But overall, the summary was that TA downregulated expression of IL-1 beta in the membrane. However, ACS and APS both produced a stronger anti-inflammatory effect by modulating pro-inflammatory cytokines involved in the cartilage destruction in OA. Both APS and ACS performed similarly despite the different profiles, both demonstrating a chondroprotective effect by upregulating matrix gene expression, while TA did not modify gene expression. Both ACS and APS reduced PGE2 in media compared to TA, which could be one of the reasons horses with naturally occurring OA show improvement when treated with ACS or APS. And since the cartilage is characterized by its poor intrinsic capacity for repair, treatments that slow down the degenerative process and increase the reparative response would obviously be ideal for OA treatment. Overall, I really enjoyed this study. I love the design to reflect the clinical situation of collecting a horse's blood, processing it, and then treating their own joint. I love the analysis of the cellular, cytokine, and gene expression profiles. And I love that they included the standard of care as well as the negative control in their analysis to really gain some insight. Obviously, I would love to see this expanded. I would love to see a follow-up in vivo study to see if what we're observing in vitro translates clinically. But what are your thoughts? I would love to hear them. Please keep requesting copies of those papers and sending me papers to review. I want to help you feel like you know and understand the science that's being put out there. For the text version of this episode, you can head to our blog. If you have questions on this episode or a paper you'd like for me to review, please email me at adrienne@ardentanimalhealth.com. I hope you all have a wonderful week. See you next time.